A common question I get as an occupational therapist who works with seniors is what is the difference in residential living environments for senior citizens? Let's get right into it. I'll discuss the different settings with you, starting with the least amount of assistance provided by the facility and ranging all the way up to the most amount of assistance provided by a facility. The first setting we'll talk about is independent living facilities. As the name implies, to live in an independent living facility, a person needs to be fairly independent. And that means that they would need all of the skills that they would need to have if they were living in a private residence. The only assistance that is typically provided is lawn care. Now, depending on the individual community, they may offer additional services such as social activities that residents of that community can participate in, but generally the residents are unattached houses or duplexes, condos, that kind of thing. And there might be a common dining area, but that's usually at a separate cost as well. Not all places have the common dining area, but some of the nicer upscale facilities do tend to have them. Next, we'll talk about assisted living facilities. These facilities tend to have the widest variation in what services they cover, so let's break it down. When I first graduated occupational therapy school in 2008, in order to live in an assisted living facility, you had to be almost completely independent with your self-care skills and mobility, but that's no longer the case. A lot of assisted living facilities have different tiers of care, and the cost of living in that facility is contingent upon how much help the person who's going to be living there needs. Usually, to get the cheapest cost of care, the resident needs to be completely independent with getting dressed, getting on and off the toilet, and maneuvering around the facility, whether that be walking or at wheelchair level. Some facilities do insist that all residents have supervision for bathing, but that isn't the case with all of them. Some assisted living facilities do charge more if you need a staff member to sit in the room with a loved one while they have a shower. And then on the flip side, some insist that there's a staff member in the room, even if your loved one doesn't necessarily need it. So it's really important when you're shopping for an assisted living facility to ask them about the cost associated with that. The other two big cost factors in an assisted living facility is if your loved one is going to need to pay to have their laundry done and if they need help with medications. Some assisted living facilities will even have an upcharge for medications that involve an injection or some other more complicated process. Diving in a little bit deeper with assisted living facilities, most assisted living facilities will provide some degree of assistance for getting dressed and getting on and off a toilet, but that's where you start to see a little bit more increased cost. Now, if your loved one just needs help maybe getting on their socks, and that's the only thing they need help with all day, you might not see much of an increased cost. But if your loved one is needing help consistently with getting on and off a toilet, including wiping or getting their pants up, in addition to getting dressed, that's where you're really going to see the cost increase. A couple of other important notes about assisted living facilities is that most assisted living facilities, if not all of them, do not allow for the use of a mechanical lift for people who live there. And for a mechanical lift, I mean any machine that might get you in and out of bed or in and out of a wheelchair is not allowed. Something that is really cool is therapy is becoming more readily available in assisted living facilities. A lot of assisted living facilities have a therapy company that is contracted within the facility that can provide physical, occupational, and speech therapies under Medicare Part B or private insurance. If they don't have those available in-house, there is the option to get home health therapy. Something I really like about the assisted living facilities that I've provided services in is that they are very social and very active communities. Some assisted living facilities even have little diners attached to them, but a lot of them have regular scheduled activities, including activities that are off-site, such as they'll go out to eat or go to special events in the community. And I think that's really important for seniors in order to maintain their health and longevity. One of the highest assistive levels of residential living facility for seniors within the United States is the nursing home, skilled nursing facility, or long-term care. Although we have several different names for these facilities that provide more assistance, the name that we use distinguishes what the person is there for. So for a skilled nursing facility, a resident or patient is usually there for a short-term period of time, receiving skilled therapies and nursing. When we refer to long-term care, that's usually a reference to the residential part of a skilled nursing facility or nursing home, and the residents who are there are planning to live there long-term or maybe there on a respite basis while a family member is on vacation. But either way, in long-term care, a resident can receive maximum amount of assistance in all areas of care. So if they need complete help getting dressed, eating, getting a shower with mobility, anything like that, the long-term care staff has it covered. Long-term care facilities can also provide complex medical supplies, such as bariatric beds or uses of mechanical lifts. Exception to this rule might be if a person requires use of a mechanical ventilator for breathing. Not all nursing homes or long-term care facilities are equipped to handle ventilation, and so you'll have to check with the individual facility to see if they provide that service or if they can refer you to another facility that does. Another unique setting that I haven't talked about so far this video is memory care. Memory care facilities are set up for people with Alzheimer's, dementia, and you may even see some residents with conditions such as Lou Gehrig's disease or Parkinson's. Memory care units tend to be locked since a lot of the residents do have a certain level of confusion and are prone to wandering or getting lost. With that being said, a lot of them also have closed-in courtyards where residents can safely go outside and enjoy a garden without the risk of getting injured. When looking at different communities in which to live, you may find an organization that consists of several, if not all of these different types of settings. This is especially more typical of urban communities. There tends to be a lot more options for what's available. What's really nice about this is if you have a loved one who's in and out of the hospital or maybe showing some signs of memory decline, they may end up needing a skilled nursing facility for a short period of time where they can get some rehab and get tuned back up, but then they would have the option of moving back to their assisted living apartment. What's nice about this is often the therapists who are working with them can see them in every setting of care, and there's often some staff familiarity as far as helping them get reacclimated. It's also nice to have familiar people, such as their friends, around and available to visit with. Thank you for joining me today. I'm Traci with Village OT. If you are looking for more information on helping out a senior in your life to maintain their independence at home or the living environment that they're in, and you're needing some more information and support in that area, I would love for you to subscribe and turn on notifications so you don't miss any content that's really helpful for you. Thanks again for joining, and I'll see you next time.